Let me move on. Dr. Martinez actually was supposed to talk on peptides and hormones, the use of peptides, and I was kind of excited to listen to that talk. I even circled it and said, "Oh, I want to attend this talk." But anyway, unfortunately, he's not here. So I actually gave this talk to the Florida Endocrine Society, and for a whole year I was kind of stressed because here I have to speak to my colleagues, and they kind of know that I've kind of stepped out. I'm kind of on the dark side, and I was afraid they were going to throw tomatoes and rotten eggs, and for a whole year I was stressed out on they're going to think I'm this quack, but I wanted to show them what I see is basically better medicine. And it's really evidence-based, and it's nutritional medicine, and it's all about getting the cells healthy and keeping your DNA healthy. And it's really, I think, I found that passion when I first attended this meeting. I was somewhere here, maybe sitting there and just listening. I was quiet. I never even told anyone I was an endocrinologist because it was like, and I was impressed, like, wow, they're really pushing the envelope. So I really enjoyed. It was like really revolutionary when I first came to this meeting. So I've seen a lot of people raise their hand. This is their first meeting. But the truth, has 3 stages. And a lot of my friends who are in internal medicine or in medicine, we agree that we're not going to discuss about medicine, but we'll still be friends. We'll still hike and we'll still do adventures, but we're not going to say who's right and who's wrong. But I think I'm right and they're wrong anyway. But anyway, and then it's violently opposed. And the third thing is eventually it'll be self-evident. So what really got me into age management was before I even got into the AMMG meeting. I remember I graduated high school in Allentown, Pennsylvania, and I went to the 10th year high school reunion, and I think I was still doing my internal medicine residency at that time. And I remember this one woman, she was really attractive. She was tall, she was blonde, and she's not that woman, but I just found her on the internet. And then 10 years later, I did find my wife on the internet too. No. It's like, what happened? So, I really wanted to ask her, what happened? 10 years, come on. But, she wasn't that bad in 10 years. But it was like, in my mind, it was like this. So, and I'm sure if you go back to your high school reunion, you may see, some people, unfortunately, age has not been kind to them. But back in my head, it's like, I'm thinking, why? Why has this person aged faster than other people? And even though I was doing internal medicine, learning about, everything you can learn about internal medicine, all the rare things, and then I wanted to do critical care and also endocrine because I love both, and I couldn't decide, so I did both fellowships. But anyway, back in my mind, I was thinking, why did that, person age like this, fast? And so anyway, we'll talk about that. So this is what I saw when I was practicing endocrinology. I've been practicing, standard conventional endocrine for 10 years, and you get them on Synthroid, and then eventually, they go, get depressed, and get Prozac, and then they can't get an erection, so they're Viagra, and then they're diabetic, and then glucophage, and they're a little depressed, so Xanax, and then they have arthritis, rheumatoid, and they get methotrexate, and then basically dead. And so, it's not good quality of life. And that's why I saw the system broken. And when I came to this meeting, when I was sitting in your chair, listening to other speakers, it was like, wow, this all makes sense. So I actually, in 2008, started my own practice. I had a very successful practice back in Winter Haven, Florida. I was in a multi-specialty clinic. I was the first endocrinologist in town. I was swamped. I hired a PA and we're still swamped. And the thing is that when I came back from the conference, I told my family, I'm going to quit this job and start my own practice. And that gave a lot of stress to my dad. I think he got IBS from that. But The thing is that he's the type of guy that basically you get a good education and you get a job and you stay there. And he was a professor for 30 years and didn't move. But for me, it's like I just could not practice anymore, and I wanted to basically do something different and see if I could really do more of wellness rather than disease-based. So in 2008, I actually started my own practice, and a week before I started, this is a true story. Now, there's two versions, my wife's version and my version, but this is, I know the version is right because this is the question I asked her. And I asked her like a week before I started, I go, do you think I'll make it? It's a cash practice. I opted out of Medicare. I'm accepting no insurance, and I'm not going to the hospital. I have no beeper. And you know what she said? She goes, I don't think so. And I was like, can you call 911? There's a knife in my back. And then she goes, no. Later she goes, no, I never said that. But anyway, this is what we should be doing in practice. And, this is, you really want to see, I love to see Dr. Life to be over 100. I mean, that's what I would love to see Dr. Life. But, and he's 75. Isn't he amazing? It's truly amazing. And, this is my hero, and I unfortunately died too young because I really was waiting at 100 what he was going to do next, because he would always do something unique for his birthday, and he had it right. He actually he was ahead of his curve. He talked about exercise, talked that sugar's the devil. And it's just you got to get up and move and eat healthy and take care of your body. So he had it right. I mean, just basically. He was ostracized when, when he was talking about starting his first gym. Doctors would say, why do you have to go to the gym? And, now, it's like you have to respect your body. You have to basically, if you don't, you have to kind of be like an athlete. You have to basically worship your body. So what we're going to be talking about is assessment of health, then talk briefly about the dangers of living in a toxic world, and in addition, benefits of some hormone replacement. We'll kind of put it all together with the different hormones. So what one test would you do to see, well, there's different tests, but what test would you see if one is healthy? Anyone? CBC? No, I wouldn't do that. Exercise fitness, yes. You could do waist size. Well, here's a dynamic testing. You can actually do a VO2 max test, and you can see exactly how cardiovascular fit they are. It's better than a stress test because you're going 100%. You don't have to go like 85% of your maximal heart rate. You're going to go to the anaerobic threshold and beyond, and you want to see how far they go beyond anaerobic threshold, and you want to see exactly what their VO2 max is, and how strong their lung capacity is, and how strong their heart is, and in addition to see how their muscular strength is. So it's a great 10 to 12 minute test you can do, and it's a great predictor for heart disease. This is actually, he actually won, he's one of my patients. I won't tell you his name, but he won the gold medal in swimming. So I have a lot of athletes, basically. He won a long time ago, but anyway, he wanted to go back 10 years later into the Olympics. Anyway, this is another test that you can do. And I think the most important test, even if you want to see how healthy you are, because everyone, in your practice, is like you can recommend the latest vitamin or latest supplement or latest this and all that. But how do you know it all works? Because you really want to know how healthy their DNA is. Because if you don't have healthy DNA, this is what I tell my patients all day long. You're going to have premature aging, like wrinkles. You're going to basically have chronic disease, like hypertension and diabetes and anything else. And then you're going to have cancer and then death. And the thing is, you got to keep your DNA healthy. And that's what I try to do in my practice, is assess their DNA damage and then see if I can reverse it. And you can reverse it if caught early.